Okay, great. Well, thank you again to everyone for taking the time out of your day to join presentation here. Our program entitled Automating Regularly Scheduled Series in Academic CME. By way of introduction, I am Jeremy Lundberg, and I am the CEO of DLC Solutions and EthosCE, which is our enterprise-level learning management system for continuing education and health professions. Since 2001, we have been the CME technology partner for leading academic medical centers, medical associations, and health systems. And so today I'm really looking forward to our discussion on the use of technology to automate RSS and academic CME. In addition, I will be sharing some of our experiences and suggestions on the effective strategic planning and implementation of these types of learning management technologies to the CME enterprise. So let's get started. This program is being recorded, and the phones will be on mute just because of the size of the audience that we have. But please do feel free to send in questions via chat, and I will attempt to answer them the best that I can. So thank you all again for your time. So our agenda here today is just to briefly go over some of the benefits as well as barriers to technology in CME, more specifically around learning management solutions. We will also be talking about some of the differences between tactical planning as well as and the benefits of strategic planning for implementing learning management technologies within your setting. And obviously, I will be giving a case study, but obviously the focus of our discussion today, which I think is a good area to focus on because it certainly is a large pain point for many organizations, is around the management of regular scheduled series. So some of the obvious benefits in CME is that you ultimately want to enhance the learning experience in an intuitive environment for you or for your audience. It's always optimal to have a centralized location as well as the standardization of CME data. Opportunities to improve your regulatory compliance as well as demonstrate appropriate outcomes measurements. The ability to decrease administrative costs, such with as it relates to automation of data, the reduction in calls to your offices through automation and streamlining of administrative tasks. Just one example there is that a association that we worked with, just by providing access to folks' transcripts, to physicians to their transcripts and certificates online, they saw a 47% reduction in the number of calls coming into their office, support calls. So really simple things like that, as well as also integration with other key stakeholders, which may be joint sponsors, maybe other departments, other institutions that you're partnering with. Certainly are just some of the key benefits around technology. And then obviously what we'll be talking about today is automation of not just RSS in terms of application management, but also using popular technologies such as mobile and smartphone technologies to really automate and simplify the administration of this particular type of CME. So universally, what I found over the last 15 to 20 years of working on the technology side of CME has been some of these barriers, which are pretty universal. I was speaking actually about 2 years ago with a client of mine, which is a large academic medical school and they generate a lot of revenue in terms of grants, commercial support, and so forth. And he told me that the annual list of IT priorities for the medical school came out, and even though they, were cash flow positive and were generating revenue for the School of Medicine, that on a list of 31 priorities that the Department of IT had, the CME department was 28. And that really left them at an obvious disadvantage. All of you would probably agree that you're being asked to have, or there's increased regulatory environment and a constantly changing one, but also with a decrease in resources, both in terms of staff as well as budgets. I think I also see is kind of a pervasive belief or a sense of discouragement when I go in and I speak with universities, or even just speaking with my colleagues in the Alliance, is this general sense that their particular organization is just so far behind the ball as compared to everyone else as it relates to technology. And I can say from my own experience, and is that that's not the case. A lot of organizations, regardless of their size and stature and so forth, have a lot of very universal issues as it relates to the application of technology. And a lot of it has to do with strategic planning and thinking, and certainly the resource issue as well. But it is multifaceted. But what I would say is that your organization is probably not as bad off as in terms if you compared it to 5 other or your friends and colleagues at other institutions and polled them, you would probably find a lot of commonalities there. And ultimately, what I do find is that, and this really is not meant to be, absolutely a negative, because it's something that obviously we're here today to discuss, but there's a real lack of strategic thinking and planning when it comes to learning technologies or using technologies to automate administrative tasks. Everything is very tactical, or a lot of the thinking that goes on in planning within organizations is very tactical. We need to do evaluations. Okay, let's set up a SurveyMonkey account, and we'll do our evaluations there. But they're not really thinking about, how are we going to integrate that data with their learner profile and other types of things. And I've always found this very interesting because there's so many other areas of CME that is so methodical in its planning and structure, particularly around, this is an example, the development of needs assessments, grants. There's very much is a stepwise approach that typically engages, different stakeholders and brings in different perspectives. There's a methodology behind it, and it's that type of structure and planning that really can help and benefit you as you start to think about applying technologies to your CME organization. So this is the common model of what we encounter, again, whether it's a university, health system, medical association. This is very similar, where you have these technology silos. And so you may have a database, that is handling your registrations for live meetings and meeting logistics. And then you've got another website and database that's handling your online courses, and then your evaluations are being handled by something like Zoomerang or any of the SurveyMonkey and the other evaluation tools. And then there could be any number of ways in which assessments are handled. We still do encounter folks that are having assessments being faxed in and manually graded, and then certificates emailed. And the one thing that's relatively universal is that none of these applications speak to each other. They all reside in separate silos. They may be maintained by different people or different groups. Some of them may be proprietary. Others could be homegrown, that were, a database that was developed by a consultant, who came in and then left and moved to another state 5 years ago. And there's no documentation about, how the system was built, and it certainly hasn't been maintained. And what I see is that, and we'll see this in this case study today about RSS, is that that Excel tends to be one of the primary mechanisms for gathering data, and then manually merged. And email, people's inboxes unintentionally tend to act as a database, storing all of these, hundreds of spreadsheets that then have to be manually pulled together. So that's what we run into, and that's been, for many, many years, and not much has changed in that realm. So when we work with clients, we really want them to start thinking about the benefits of thinking strategically rather than tactically. That last slide showed the outcome of thinking tactically about learning management technologies and technology in general when it's applied to CME. So just like you would think about if you were developing a needs assessment, educational plan, the department budget, any of those types of things, a business plan, you want to take that same type of an approach in thinking about how you would, some of the key steps are to strategic planning as it relates to technology. So you want to convene and interview different key stakeholders, whether they are within your office of CME or the Department of Education. So they can be CME coordinators. They also could be folks that are in external departments within your institution. Bring in IT. Even if IT doesn't necessarily want to support it and host an application, they still can give you some ideas about what are some of the guidelines and policies that they have in place about what types of technologies you're allowed to use as an institution. Then identify and operationally define what your organizational pain points are. And I will say that in my interview process with colleagues is that when I ask them to identify 3 to 5 pain points that across their staff that they experience, on a daily basis, a lot of time that is met with a lot of laughter, and trying to whittle them down to 3 to 5 pain points that they experience really tends to be a challenge. But those pain points are really helpful in going to the next step, which is identifying your short and intermediate objectives. So a pain point could be is that right now when we want to collect attendance, we're trying to at a Grand Rounds event, we're trying to read off of sign-in sheets, and we can't read their writing, and people are using different email addresses, so we end up with duplicate, entries within, our SQL database that we've created. Those types of pain points may have to do with ACCME reporting as well. But they're great at helping to identify short and intermediate objectives, and then also allowing you to develop, requirements and use cases. What do you want? If you had an ideal system, what would it do? How would an admin or a CME coordinator or director or an event planner interact with the system? What type of data should they be able to get out, and in what format? So identifying those use cases and requirements, and then selecting a type of application that you think will fit. And again, this doesn't have to be firm, But if you know that IT wants nothing to do with hosting an internal application, then you probably want to look at like a software as a service application that's hosted elsewhere, and you pay a monthly subscription fee. All of those types of things. And then you absolutely want to ensure that you have management buy-in and leadership buy-in for your initiative. I can tell you that there have been many an ambitious plan by middle management and kind of the folks that are on the front lines, and only to really just have the initiative and all the planning that they've done and everything just stop in its tracks because leadership really wasn't interested in it, or they've got other priorities for their budgets, or they're under budget constraints, any number of things. But it's really important to get that type of buy-in and really know where you stand as you go through the process. And vice versa, if you are in a senior leadership position, you really need to convey to the team what level of buy-in there is to support these initiatives. And then pull this all together into an RFP, and it does not need to be elaborate, but just getting ideas down. I mean, if you have the resources, getting someone to help you with an RFP, a consultant, is a great idea, and help you identify a handful of vendors that you think would fit the bill, and have them bid on the process or the initiative. But providing the structure, and then through this process, you should be able to answer these critical questions. What are my budget parameters? If you've only got a budget of $50,000, but you're looking at, you've put together a must-have requirements list of $250,000, that's not, you're still going to be in the same situation because you don't have that $250,000. What are your priorities, and how realistic are your timelines? If you want to launch an enterprise learning management system, or you have 12 hospitals in your health system that you're managing RSS for, don't come with the mindset of thinking, we're going to automate all of this. Today is February 1st, and by March 1st, all of this is going to be automated. Keep it realistic, and if you have to, break things into phases. Think about how is your strategy going to be supported internally and externally. What staffing and resources are required for you to support this technology. What systems, if you identify the systems you have and work with your learning management partner to identify what systems are there and can be consolidated, what can be retired and have the data migrated into a centralized system, and what can be integrated with. A content management system or HR system, those types of integrations really can glean some valuable data, and obviously the automation of the exchange of data between those systems. And then, again, do we have the necessary management and leadership buy-in, which is absolutely critical. So one of the, this is the POST methodology. This was developed by the Forrester Research, 2009. I really like it. I use this with both myself. I use somewhat of a hybrid of it when I'm starting to think about developing a strategic plan. I certainly recommend this to the organizations that we work with, and in fact, for any of you that are going to be at the Alliance meeting, myself and a couple of colleagues from the Emerging Technologies Committee of the Alliance are doing an intensive workshop on Wednesday mornings, 4-hour workshop on strategic planning and how to apply this POST methodology to developing a strategic plan for technology. So maybe that might be something you'd be interested in. So one of the real things that I like about POST is that, one, it's an easy acronym, but two, so often people will say, and I get these emails or phone calls, and they say, Jeremy, we need a blog. And I'll say, great, certainly we can do that. Why do you need a blog? Well, I was at a conference last week, and my friend, boy, he's got this blog, and it's amazing. Well, what would you do with the blog? I don't know. You really need to look at his blog, and that type of thinking is backwards, which is you need to actually fit the technology into, or picking the most appropriate technology once you start to understand the people, objectives, and strategy. So if you put technology last, you first want to identify and research your target audience, and figure out their technographics. How do they use technology, as we'll be discussing in the case study. If we're going to be automating RSS, who is our target audience? Well, they're going to be physicians, they're going to be nurses, they're going to be other allied health care professionals. Okay, so what types of technologies do they use? If we're going to be using mobile devices, how many of them have smartphones? Of that, how many people use it on a professional basis, and do they have text messaging turned on? Those types of things will help you in your planning. Then, based upon that, set realistic goals, and objectives, which is, by the end of 6 months, we want to have 70% of our attendance being tracked automatically, let's say through a mobile device and stored in a database. Only 30% will be tracked by sign-in sheets, and maybe come up with three to five realistic objectives. So then formulate some clear and concise strategies about how you're going to do that. And then ultimately determine, based upon those elements, determine what are the most appropriate apps or technologies to get you to that 70% of automation. Don't ever pick 100%, because you'll just end up being disappointed. So once you've outlined these steps and you start to think about this, and this is one of the things I really like about Post, is that when I started using it when it came out, now I pretty much think of this way about everything that I'm doing as it relates to strategic planning. And it's easy also to share with my colleagues. It's also very easy to communicate to folks that I'm working with who have not done strategic planning before, or have a real issue within their organization. So it does help with buy-in and getting people engaged. And so also they're not looking at you like you have 10 heads. This could be a potential outcome when you think strategically about what a model is for technology within CME. And again, this will vary among organizations, but you want to have your audience coming in through one content management system, your main website. They're going to log in once, and that's going to authenticate them automatically into the learning management system, so they don't have to sign in twice, and it creates an account. And when they complete a particular activity or are marked as attended within RSS for grant rounds and so forth, you can have that record go back over to maybe your hospital HR system as well, or you can automatically generate your PARS report and upload that to ACCME for this as well. And so you want to get this bi-directional, really an integrated approach with not only your internal elements and consolidate those elements within your organization, but also think about how you're going to interface with your external education partners, with third-party applications such as MailChimp or Constant Contact for doing marketing of programs. But you want all of these playing together, and also, wherever possible, eliminating manual entry and the types of tasks that really just are a drag on your resources and also on your staff. So I thought that this would be a good example. RSS, I will tell you, is the management of it. Well, I don't need to actually tell you. That's why you're all on the phone at this presentation. But is a significant resource drain on CME organizations. So I want to just set the stage with and talk about a major academic medical school and health system that we started working with in 2010. They had, those separate silos, that slide that I showed earlier, where multiple websites, some that were handling enduring materials, others that were handling registration for live programs. They had different databases, some that held evaluation data, some were proprietary, some were developed in-house. So we were engaged, and they were doing a lot of activities. As you can see, 5,000 plus activities per year, over 700,000 certificates issued, and they were at that point 90 RSS. So we were engaged to implement our EthosCE Learning Management System. And this is a system that has been designed for CME, and it is ACCME PARS compliant. But we've spent a lot of time not just on creating, an intuitive interface for students and learners where they can easily engage in courses and get their transcripts and so forth, but also focusing a lot on the automation and consolidation of all of these, different silos. And integrating them, and ultimately streamlining back office administrative tools. And so in the process of working with them, it was interesting because it was not something that we were initially engaged to tackle. It just came up through the course of our working together and conversations. But a real pain point for this organization was that from the time that a physician attended a grand rounds or a case presentation, it took over 6 months for that to make it to their official transcript. So that was frustrating for the Office of CME, who was hiring temps to do data entry to try to catch up, but then they would end up having additional RSS. It was frustrating for the faculty, who had to call constantly asking for their updated transcripts. And it was very frustrating also for the department CME coordinators, who were trying to figure out these paper sign-in sheets. And again, they had tried barcode scanners, and that wasn't working so well. One, because of the cost; two, because the rooms would get changed, or the schedules where the grand rounds were happening would get changed, which meant you had to move the hardware to these other rooms and then test it. So they really were relying on a process that was paper sign-in sheets for folks that were attending the RSS. But when a department coordinator wanted to get accredited for a new RSS, get approval for that, they would complete a Word document, email it to the Office of CME. Often it was incomplete, didn't have the disclosures and handouts and so forth. And so Office of CME would send it back, asking for the complete application. And this usually took anywhere from 2 to 5 times before the Office of CME would actually get a full application. And so it was very frustrating from an administrative standpoint for really all parties involved. They also had one full-time employee that was reviewing the applications, doing on-site visits in the different departments, training new CME coordinators as they came on, handling approvals, addressing peer review. I mean, it was a lot. A lot to manage, and it was all being done manually. And so we sat down together and interviewed different key stakeholders. They also had some focus groups as well to identify the pain points and it was very easy for people to identify the pain points. And then we also mapped out what their current workflows were. And it became very clear to everyone was that that RSS was screaming for automation. And so we thought about a number of different models, but really wanted to get something that was a low barrier. So using technology that would not present a barrier to use for their particular population. And so we thought about, let's create an iPhone app or an Android app. Well, then you may have some problems with connectivity to the internet. And so we were going through, do we go back to barcode scanners, different types of things. And we decided, you know what, let's try this with text messaging. And I'll take you through the workflow in a moment, but we developed a workflow. We implemented that workflow and rules based upon our client's requirements. We customized the LMS, EthosCE, and then we launched a pilot study, and they also did a large-scale survey of their population, and I'll share the data with you in a moment here. And then we came back, revisited the workflows, and optimized them, and then I've done a full launch. And so this is the mobile attendance tracking workflow that we collectively came up with. And so an application, the Word application, was put into Ethos as a web form, and there were a number of rules within that web form that required certain criteria to be met. So you had to upload a disclosure, you had to upload a handout, all of those types of components before it would allow you to send it to the Office of CME for review. And there were email triggers that would let different departments know that they had an application pending for review, and so forth. And so each department got their own dashboard. So cardiology could create their grand rounds and case studies and presentations and so forth. Obviously, they could not see the Department of Oncology or the Department of Neurology. Everyone had their own, or has their own, dashboards. And then ultimately, the Office of CME can see everything globally. They can see all the departments, all the pending applications, all the applications that have been approved, where they are within the system, where they are within peer review. So once an RSS activity in the system has been approved or created and sent on and reviewed and approved by the Office of CME, a trigger is sent back to that department coordinator, and an email notification goes back and says, your activity has, X has been approved. And so they log into EthosCE. They go to the activity, and they are also given what's called a short code. And so they hand this out at the end of the grand rounds or case presentation, and then the attendees simply will text. Actually, I can show you. This looks like. So they type in the passcode. Now this goes up to EthosCE and finds them in the system. And the first attempt they had a typo, so this starts invalid. They now type pass-fail. This is thank you for your submission. And they are marked as attended in real time within their transcript in EthosCE. Right there, they can now log in at any given time, and the attendees, they can get their updated transcripts. we were able to take a 6-month backlog and make it into real time, and then ultimately, just by clicking a button, the Office of CME can generate their PARS report and upload that to ACCME to their web service. So if we look at some of the metrics on this, as part of the pilot, they were able to get close to 80% of the healthcare professionals using the mobile attendance tracker within the first 4 months. Of those who did not have it, and this again goes back to those technographics. So when we talk about post, we're understanding the people here. So we want to understand that 17% had a smartphone but did not have text messaging turned on. And then there's 2.4% of their faculty who did not have a mobile device at all or a smartphone. And as our client would say, I can tell you exactly who those people are. And so that's why I said never try to go for 100%. And so this 17% is probably diminished now because more the healthcare providers were seeing a real value in this, which was, boy, if I turn on my text messaging plan for most nowadays are free, but for $3 or $7 a month or whatever, I always have access to my transcripts. And in terms of ease of use, this was another thing, was that when we were doing our research and speaking with other institutions and our other colleagues at academic institutions, they were kind of skeptical, some kind of laughed, when we said we were going to deploy this type of method for automating RSS. You're never going to get the docs to use it. And our thinking is that they're using this technology in their personal lives. They're probably texting colleagues and so forth. Why would they just all of a sudden draw that fine line at, but I'm not going to actually do it for grand rounds and my transcript management? That didn't really make sense. And so the data, really supported what our thinking was. Ease of use, which obviously you got to make technology easy if you want people to use it, but they rated it a 4.7 on a 5-point scale. And clarity of instructions. Granted, our client also too, and this is important, did create training manuals and training opportunities to show folks and faculty how to use it. That rated excellent as well. So the results, in addition to that data, is that also now the Office of CME and all of the departments had a single centralized point of entry. All of the documentation related to their activities were located in single dashboards for different authorized users. You had educational formats being displayed in a uniform manner to learners, and learners had easy access to registration, certificates, and transcripts. And when we talked earlier, when I spoke earlier about sometimes just fixing little small pain points can have a dramatic effect. When we go back to the one association client that we had, that just by allowing access to transcripts, phone calls to their office dropped by 47% in 3 months, which is pretty dramatic. And obviously helping out with their data collection for ACCME and other program reviews. And this is an example of the dashboard. This is for cardiology. We can see all of their approved series, how many they've had approved. You can generate the PARS report just by clicking a button here. You can send out broadcast emails to all of the people that are registered for or ever have participated in these events. And prior to a grand rounds or a case presentation, the participants get an automated email that contains the handouts and disclosures and so forth ahead of time. And then the savings, the cost savings part of this was a lot of folks will talk about, the expense of technology, but when you can start to compare it with the costs of full-time employees, temps, and full-time employees that are focusing not just on their day jobs, but all of these additional tasks with data entry and phone calls and so forth, it really adds up. But adding temps for data entry, all of the back and forth and wasted time, here we identified just a reduction in data entry errors and manual entry. Instance availabilities to transcripts, instant reporting capabilities for administrators and coordinators. Everyone is on now the same page. They know who is doing what, and how many people are attending different activities. Overall, the less issues around approval timelines and the ability for them to turn the Office of CME to turn around approvals in a much expedited fashion as it relates to peer review and all of the documentation being in one place. So thank you. I know we covered a lot of ground, but I greatly appreciate your participation. Let me see if I can answer any questions with just a little bit of time that we have left. Okay. So our boss is not all that tech savvy, and therefore goes silent when we request to try to make the case that we need to join the 21st century. How would you handle that? First I would really go back to what we were talking about earlier, where I was talking about earlier, which is using that post methodology and getting a sense of the technographics around your target audiences, and also operationally defining the pain points within the organization. And then developing some metrics and case studies around other examples where this is offset, where technology can offset and automate costs. And if someone is not tech savvy or has their focus elsewhere, which is fine, there's a lot of things to be, obviously that require one's attention as well. But present a compelling case using data wherever possible, and operationally defining different pain points to help make that case and to look at costs. And if you've got a list of must-have requirements, maybe 50, maybe you start breaking them down. Maybe you start breaking down those into must-haves and nice-to-haves, and maybe later type of an approach, or looking at cheaper ways of doing things. So instead of using text messaging, maybe just using a mobile browser, where they just log in through the mobile browser and enter in a code for that activity, which could be 1, 2, 3, 4, 5, and they're logged in that way. And then we've got another one here. Let's see. Okay. Have you experienced clients who have had difficulties getting the department coordinators involved? You see that as a potential problem if the Office of CME is relying on them to use the online system before credit can be given, which really just hurts the physician attendees. Absolutely. And not just apprehension from the departmental coordinators, but also there's probably 2 different organizations that we work with, and one of their challenges is they're absolutely willing to train the department coordinators. They just have a very high rate of turnover of the department coordinators who are not part of the Department of CME. So you're once you get someone acclimated and trained, within the system, and you've got their buy-in, they've moved on or been promoted or moved, to another position elsewhere. So that has been a challenge, and that's why what we recommend is a train-the-trainer type methodology where we come in and we'll train the staff in the Office of CME to then be able to go out and train those other department coordinators, and also to show them kind of right off the bat how this is going to improve their day and what their life is like on a daily basis. I mean, we have other data about the ratings from department coordinators, which was really interesting, was how much the department coordinators loved the new dashboards, because they went from having to manually enter in, type in, 30 to 50 names to now maybe on average they have to manually check off in the system, not even type in, but maybe 1 to 3 people a week. Yeah, that got some instant buy-in there. But it's the train-the-trainer aspect to it is definitely recommended. But turnover is, particularly at that level of position, that type of position, whether they move to other parts of the health system or get promoted and so forth, certainly has been a challenge. All right, and if there's no other questions, I want to thank everyone so much for taking the time for our discussion today. I do hope it was helpful. You can feel free to contact me at the information provided. I also will be at the Alliance meeting, both presenting on performance improvement as well as 2 other presentations on technology. But we also will have a booth, number 421, EthosCE. So please feel free to stop by, and thank you again for your time. I look forward to hopefully meeting up with you in San Francisco.